Hi, I'm Joy Klein with Path to Joy Wellness and Trainings. As a healthcare professional for 14 years, I realized that a lot of times my clients simply needed to hold a hand and feel the power of touch to help them feel better. Well, guess what? I know you as healthcare professionals are already doing this, but I'm going to teach you an incredible targeted way to decrease their anxiety, to decrease the tension in their body, decrease their stress level, and decrease pain while you're holding their hand. It all stems around this concept called the 4 handy rules of thumb. And the nice thing is, you're already holding their hand, but this is a very simple way to make them feel better. So, what we're going to focus on first is number 1. Here's a tip: touch the fingertips. For those of you who work with people who have cognitive or mental issues, this is going to be really key for you. I do this with dementia patients a lot, and it helps them considerably to be more focused and to actually be more compliant with care. So here's how you do it simply. This represents the brain, by the way, so this is a way to calm the brain. Just touch each fingertip. It also works for stressed out healthcare professionals and frontline staff, by the way, if you're having a rough day. So I encourage you to use your fingertips and calm yourself before you step into a hard situation. Number 2, to be centered, touch the center. I love this technique because it's a great way to reset that person and help their body sigh. It takes the tension out of the body. The reset button is right here in the middle of the hand. And I encourage you to press very gently. You don't have to press harder to make it work, but this essentially makes the body sigh and relax. Here's a technique for you. It's called the grab and go. Let's say someone you were working with is very tense and they're hurting. Maybe they have pain. If you hold their hand, you simply grab that part of the hand while you're talking with them. Make eye contact. Talk to them and say, it's going to be okay while you're pressing this button. Then you can use number 1 while you're doing it, while you're holding their hand. Press their fingertips with yours. And how simple is that? You're already doing it anyway, but this way they will feel even better. The third of the 4 handy rules of thumb points: stressed out, work the adrenals out. As we know, as a healthcare professional, most of our clients are stressed because they're not feeling well. So getting the adrenals balanced is key. So the adrenal point on the hand is literally right here where the thumb joint and the finger joint join. And for most of you, when you try this, it's probably going to be sore. And that probably means that you are stressed. Encourage you to keep doing that until the pain goes away, and that means your stress levels will balance out. But look, again, you're holding hands. You can simply rub that person's hand, even if you're using lotion or just holding it, and you're going to relax the stress hormone in that person's body. The 4th point of the 4 handy rules of thumb is rule of thumb, touch the thumb. There's 2 ways to remember this. Give yourself the thumbs up or do the okay. You're going to be holding your patient's hands though, so what you can do is simply incorporate that into your hand holding. Gently rub the thumb, and what that does is it balances the hormones in the body. So for people who are depressed, it'll increase their serotonin levels, for example. For people who may be hormonal from menopause, it will help balance their estrogen, testosterone, and other hormones. It's also great for decreasing stress hormone as well, and all the hormones that help with digestion and metabolic functions. The 4 handy rules of thumb, I want to encourage you to use this on yourself as well. Before you walk into a patient's room that you know is going to be particularly challenging, I encourage you to do this so that you're calm, you're centered, and that you are ready to be as efficient and effective as possible with that patient. Then when you do this for them, guess what? They're going to feel more successful with the care you provide. What I also find is when you use the 4 handy rules of thumb before a medical treatment that might be invasive, like nebulizer care, or maybe wound care, or something that's scary for people, This will help the patient be more compliant and open to getting the treatment. And I do offer trainings to frontline staff and healthcare professionals in your facility to teach you even more about what you can do to help your patients have a more successful day, and that you can actually enjoy your job more. I enjoy Klein with Path to Joy Wellness and Trainings, and I care for people who care for others.